Are you building fast but feeling fried? That's a silent signal that something's misaligned. Today, Monica McKitterick, founder, clinician, and leadership coach, unpacks how aligning your nervous system changes how you lead, hire, and grow. You'll learn why slowing down isn't a setback, it's a strategy. And stay tuned because in the next segment, Monica shares the exact tools she uses to help clinician founders scale with clarity, not chaos.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Before we dive into today's expert conversation, I want to pause for a minute and talk directly to the innovators in the room, especially if you're preparing for a raise or aim to land a pivotal partnership this year. Your pitch isn't just a story, it's a strategy. And if you're still guessing what investors or decision makers want to hear, you're already behind. That's exactly why we built Pitch to Yes. We don't just critique your pitch, we co-create it with you. You will walk away with a persuasion scorecard and a written pitch that turns attention into action. Apply at pitchtoyes.com. Now let's dive into today's conversation. We have Monica McKitterick here with us. She is a nurse practitioner, an entrepreneur, and an author. Someone who's super passionate in transforming healthcare for both patients and providers, and specifically dive into how all of us as providers truly can provide the care that we're meant to be, not being controlled by the system behind us who are showing us, oh, this is all your RVUs. Have you be your metrics today? So today, she is the founder of Impact Family Wellness, a multi-million-dollar direct primary care creator in the DPC formula, which she offers as a book and an e-course to help people to really see, do you even meant to be your individual business owner? I think that a lot of us become super passionate about, this is not my knowledge, this is how I want to do it, let's create my own way to do it. But as you start getting into the entrepreneurial journey, there's a lot of roller coaster ups and downs. And sometimes we're so good at just dealing with patients, but not knowing there's so much more lessons to be learned as you're stepping into the stakeholder of a business. A lot more just a provider. So how do you make that decision? Are you meant to do that? Or are you meant to maybe become a contributor? You're actually meant to be on other people's board as advisors, consultants, or investing in other people's companies. No matter what, knowing how to take better control and building something that's like direct primary care for your own community become not so much a novelty, but it's also a very critical conversation to have. So Monica, thank you so much for joining us today.
Thank you for having me.
I would love for you to share your story. Definitely is something that I think most people feel like if they're diving into creating their own business, they have to just keep going further. You have a little bit of different transition on why you start building direct primary care. And when did you hit that point of, oh, I actually know what I'm meant to do, not just building companies?
Yeah, it's been quite the journey. I've been a nurse practitioner for 17 years. I spent the first 10 of those as an employed provider in all sorts of different areas. And I was relocating to Texas, trying to figure out what I wanted to do, got a Facebook ad about direct primary care and really dove into it because what I realized is that I could see less patients, take better care of them, have more control of my time, and make the same amount of money. And so I went to my husband who has an MBA and he told him those 4 things and he literally laughed at me and he's like, Monica, that's not real life. So did a ton of work because I have 3 degrees in nursing, but not one in business, accounting, marketing, any of those things. Like, how do you establish an LLC? These are things I don't necessarily know. And so dove in, started my practice with the intention of just giving myself a job. My plan was for me, my 500 people, and that was going to be it. But it quickly changed. I realized that the direct primary care world was a service people want and they need. They just don't know it existed. And so I became a huge person in the community. I moved to Texas and literally knew 2 people in all of Central Texas. And now I know half the town, including all of city council, the mayors, like all of the stuff. And it's because I've just jumped into being with my community and educating them. So I expanded my clinic to now 3 locations. I have 7 nurse practitioners that work for me. And I actually stepped out of patient care about a year and a half ago and just serve as the CEO now. So it's been quite the transition. About a year ago, I actually went on an entrepreneur competition called The Blocks. You can watch it on Amazon Prime. You just Google it, you'll see it. I was on season 18 and spoiler alert, I actually won the season and won $10,000. And it was the first time I ever felt like, oh, I actually can run a business. Like I actually might know what I'm doing. And so that led me into this like down swirl of, okay, now I have to open 5 more clinics and I need to do it this fast and I need to do this many things. And I got so burnt out, like to the point that I made myself physically ill. And so after a lot of therapy and a lot of journaling and really defining what success meant to me, I realized that I don't need to build 10 clinics. What I would rather do is get other providers to build 10 clinics, because that's how we really get the direct primary care movement into this country so that we can have better healthcare options and not these broken systems that we have now. And so that then led me to write a book that is written for that healthcare provider who wants to know, is this the right move for me? Do I have the entrepreneurial spirit? Can I do this? And so the book is a short 100-page read that at the end of it, the answer is to the question of, should I do this, is yes or no. And then after that, I built a course that will take them from, yes, I want to do this, to the actual launch date. And that's just because I've learned so many things from doing it myself and now doing it 3 times that I just needed to share that with the world, because I want the world to know what DPC is. And we need to do that by having amazing healthcare providers along the way. So it's been quite a whirlwind in the last few years.
I think those opportunity of challenge the block, for example, and then also for people when on Shark Tank, we actually host a health tech showdown. Similar idea is that to give people the platform, maybe they didn't thought they can even step up and win, right? Like in your case, is to validate. And no matter where your ideas is, you can improve and then get a lot of crowd to behind you. And it make us feel good. But at the same time, when we get to that pedestal of a state, but we haven't quite realized where's my ecosystem, where's the center of what I meant to do I rely on yet, then we're not sure, right? We can either build so much, and then in your case, unfortunately or fortunately, even though you're burning out, but then you understand the true path for yourself now, right? Mm-hmm. It's really supporting other clinicians who are meant to do this work also build themselves. And so we even talk about this 5-dimensional way of ecosystem. A lot of people go into their own private practice or company, they're thinking about the core, right? The business core. We're saying, guess who's supporting the business core is your personal ecosystem, your family ecosystem, right? What's the dream of the entire family while you're building this legacy with your business? But then what else? Your mentor ecosystem. A lot of people who probably took multiple steps before you, how are we leveraging them, either supporting us in the business step by step, or just like sounding board, right? We can pick up a phone call, we can meet them. And then you have what we call Nexus Circle, the partnership ecosystem. Who are the people who will just see eye to eye for us, right? We cross refer, we're going to collaborate, right? It becomes this like, you mentioned, you knew the city council now, you know the whole community. Those are the amazing people that we surround ourselves in the community, and they believe in us. There's no longer convincing of things. You just start co-creating, and that's a true collaboration, right? Instead of the old traditional way, I think businesses are just passive referral. Oh, if I remember that, then I'll give it to you. right? I think in medicine, when we think about subspecialties, this very passively refer. Oh, go see a nephrologist. Oh, go see a podiatrist, right? Oh, only have it. Instead of this collaborative way, I probably can solve it in my direct primary care as well. I just want to just tap into someone else's brain, right? So a lot of time we can build things so more amazing if we know the who to help us in the right capacity, and then be more honored into what I love you're saying is I truly understand how to define my own version of success, right? And everyone has a little bit of different version. And if we truly understand that and honor that, our life become much more thriving, right? Fun. When Monica loved her role as a provider, she was chasing alignment. In today's conversation, she shared how starting her direct primary care practice went from just giving herself a job to building a multi-location healthcare business, serving thousands of patients, mentoring clinicians, and impacting policy at the community level. Her biggest lesson: success isn't scaling at all costs. It's defining what thriving looks like for you, your team, and the people who you serve. From burnout to breakthrough, Monica's journey is a blueprint for clinicians stepping into the founder's seat. So as you're in this journey, how have that been changing, right? Like, do you see most people start finding you at your speaking engagement on, for your online course? How are people finding you now? And then you're able to do the amazing work that you're meant to do now.
Sure. So I've been in the direct care space for about 6 years, and there's a decent online following. There's also several conferences, and I actually help run a conference for direct primary care, specifically for physician assistants and nurse practitioners, because most of the DPC conferences are tailored to physicians, which is fine. But there are some physicians that think we don't belong in this space, and they're entitled to that. So I have launched a conference with 2 other nurse practitioners that this will be our 2nd annual coming up. But I answer a lot of questions for people. Honestly, there's a lot of Facebook groups out there and mentorship opportunities where I just answer questions for people because I've been there and I went through it. And so somebody helped me along the way. And so I'm here to help others, but I do a lot of speaking engagements, especially in our community. And that's on things just to help out the community. I did a presentation last week at an assisted living about the signs and symptoms of strokes and heart attacks so that they can maybe save their buddy if they don't look quite right. So I love to really get involved in the community. I'm on multiple boards for different nonprofits, and just really diving in and helping the community has been not only a sign of success for me, but also like personally, it fills my cup. So
yeah, I think that's a great lesson for everybody else who's tapping into, they're already a leader or they're branching out into their own private thing, is be engaged with your own community and showing up, be a resource, because then people become able to see value in you. Then they become even more curious about, hey, what's next, right? Like, how can we get more of your amazingness? And to then help them to direct into the resources that you are building, and you, whether in your case, right, Summit, right? Like when people have direct primary care for nurse practitioner PAs, then there is a different licensing discussion, right? State restriction. So you can start helping out that sector, not just clinicians, right? Which state you can own, and some state you can't even own 100% of that clinic, as well as the other side, right? The business development side of things. How do you find a good, even just like an office manager, in the sense that, will not cut corners and then actually understand how to engage with the front end and the back end, right? And then have some knowledge perhaps to help you to promote what it is. As we know, direct primary care is still in some way, right, in competition with all the larger ACOs or groups. So how do we help the public to be able to say, oh, you're actually only paid this small amount every month. It's much cheaper and more flexible and more helpful for what you need, than have to wait for urgent care and very costly. That half the time insurance doesn't pay, right? And that's the struggle for a lot of people was like, oh, I have these premium insurance, but they're not even covering us for anything. So having these direct primary care or even these direct secondary specialty clinics has been really helpful for many people to get a second opinion even, right? Like, so they don't have to wait for days, right? And worry about what could be. And when they can really get an answer quickly from a direct telemedicine or direct primary care in your case. So I know one of your book is talking about how can people see if entrepreneurship is the right path for them. So what are some of the key points that you discuss in that book?
Yeah, one is self-promotion. I think there's so many healthcare providers who just think that all they can do is provide care. They don't know how to sell themselves. There's a great book called Everybody Sells. I'm sure you've read it. And when I first came up with this whole thought, my husband was like, well, you sell stuff every day anyway. I was like, no, I don't. I take care of people. He's like, when did you diagnose somebody last with diabetes? I was like, well, yesterday. He's like, well, what did you get them to do? It's like, well, we talked about lifestyle changes. He's like, you sold them on lifestyle changes. You told them that's what had to happen. And so we as healthcare providers are really good at educating our patients on why they should do something. But now we have to, in order to be an entrepreneur, you need to be able to educate people on why they should buy something from you, right? Where before you're trying to get them to go buy a pill from the pharmacy or make a lifestyle change for themselves. Now you have to be able to sell yourself. And that's not ingrained in everybody. And especially in today's day and age, you have to be able to do it in front of a camera because so much of what we do is in social media and YouTube and everything is online. You have to have social proof or no one is coming to you. And so if you cannot figure out how to be comfortable on a camera and speak to people or put yourself on a stage at the Chamber of Commerce luncheon, then your chances of success are going to plummet. This is not like your average primary care office where Blue Cross Blue Shield and United are just going to send patients in the front door. You have to go out and find them. And that takes a special person.
That's so true because we know social media growth, it's very heavy on educational piece. It's what we call the talking head content. You are answering a very specific question for your patients, and that's where they are scrolling and trying to find. And so many people are using social media, YouTube as a search engine. And before the two of us got on, and Monica, we even talk about Gentech AI search engine. Between Perplexity, Gemini, and ChatGPT, people are asking the full question in there. Are you able to be picked up as a resource? That's powerful, right? How do you do that? Part is writing, part is these video content. We say that enrich media. So if you are at least a good writer and you know how to write and place in multiple platforms that can get Google recognized, that's one thing. But a lot of people actually do really well by creating these short video content. Mm-hmm. Therefore, if you're not great on camera and you can't even want to just record, let's say, a podcast without video, then it is going to be a more difficult go-to-market, getting the right people come to you to serve them. And yeah, it's the half the battle, right? When we build these multi-million-dollar companies, we say before you hit 3 million, the most amount of work you're doing is marketing, sales, and operations. Absolutely. Actually, it's not the core of patient care, right?
No.
It's all the things that we didn't thought we needed, but we have to, or you have to hire a company that understand who you are deeply, authentic you, and do all that work for you.
Absolutely.
That become more
and you
costly.
don't have to be good in front of the camera right away.
Yes.
I mean, if you go to my YouTube channel and watch the first video I ever made, it is embarrassing. It is so bad. I wrote a whole script. There were all these papers behind the camera. I made my family leave the house because I was so embarrassed to even record it with them. And I'm not joking. It took at least 32 takes to get that video. And it's awful, but practice. And now I can record a video anywhere and I'm fine with it.
Exactly.
Monica no longer just practiced medicine.
she's building a platform for others to rise. From launching a summit for NPs and PAs to mentoring in Facebook groups, she's leading through service. And she's clear, if you want to grow as a founder, you have to learn to sell yourself. On stage, on video, and in your own voice. Visibility isn't optional. It is the entrance ticket to real impact. Now I want to hear from you before we go to the rest of the episode. Tag Monica or myself on LinkedIn. What is one leadership pattern you repeated more than once that might be rooted in your emotional wiring, not just strategy?
And then same thing, right? Like I have a background, I have a home studio, but I travel so much every week. You start understanding how lighting works, how you can just stage a corner and be okay, right? And it still captures you in a great light. And then sometimes like I'm so bad at even remembering putting on makeups every time I record. I'm just like, it is what it is, right? And you become, that's the part of you, right? Whether you want it to be super polished and then you can show it up a certain way. When you want it to be, this is me, this is my life, my work. And on vacation, yes, I'll carve out just 1 to 2 hour check email, but the rest of the time you guys can't hear from me, right? Then we start having this rhythm and pattern of boundary. And so that's when a lot of time we say, you can scale up. You can scale however far we can take you. However, you need to build resilience, build these buffers of what if, what's not, and be okay when those things happen. And have the mentality of everything can be solved. We just needed to find the right people to help us to solve it. Right. And that's where the resource, everything come together so much more easier and doesn't feel like, oh, I have to make this metric this way. Otherwise, so-and-so, right? We don't have to. No one's really actually like staring at you and trying to tell you what to do, what not to do. It's how you're creating more space for yourself, creating more fun for yourself, and creating more health for you and everybody who you work with. And I think that's
I had to really dial into what my worth was as well, because I really tied that to patient numbers, revenue numbers, profit numbers, and how many hours a day I worked, right? But because if I wasn't working by 7 a.m., if my staff didn't know I was working, then I wasn't working hard enough. And turns out that's garbage. My staff doesn't care how much I work as long as things are moving in the right direction. And so really dialing into what your worth is has really helped me to be more successful and not burn out.
Yes. And sometimes that's a hard conversation to have with yourself, right? Like, what does that mean? Like, have we paused enough to have an internal dialogue, or have we paused enough to actually be honest, to talk to someone, right? There's, I think last time we pulled the data, especially purpose alignment, when we build these executive boards, always, it's not just your who of the talent on this board, it's actually what's their individual purpose of that person? Does that person support everybody else on that team who are leaders? And all of these people on the leadership, do they also match the mission, vision of this whole company, right? And if that's not there, you constantly seeing people getting what I call the first day effect, right? They get so excited. Oh, there's a new idea. We should adopt this thing or that thing. But then time goes on, things are difficult. And then they're like, maybe I'll go move somewhere else, right? Just kidding. Exactly. So we have to see, yes, in some degree, we see people's resume, right? Their titles, their experience. But that's only step one. Step two is purpose. And step three is actually communication. Are they meant to be with us because they see perceptions complement the rest of us? Or they are too narrow in, then we actually box ourselves from innovating, right? And then the next level becomes that psychological profiling of how well we're working together. I think traditionally, why we feel like larger enterprise of healthcare has not worked well is they just go for alkali and then do a psychological profile like, oh, see, our personality is supposed to ABC.
but it's super one-dimensional, and you're not seeing the whole people for what they're meant to be. And they're just grabbing a body of thinking they just fill the step. And especially as women, right? There's a thought process now, there's the cliffhanger, right? So some women, they are pushed into these higher leadership position, right? Or entrepreneurs position, but they were not put there because they were believed in their ability to do things. They're put there to say, well, no one else could do this, so we're just going to see how you worked. We're not going to expect too much of you. If you fail, well, oh well. If you do well, then history have repeated. They are not recognized for that. And then they got laterally moved somewhere else. And then someone else got put on the same spot to grow to the next level, right? So sometimes I'm a big component of no matter what, we need to fight for ourselves in those positions. Women need to start leading, need to creating, and more investing. Right? When we're able to have more of these number at play, then we can sing as having a personal life, having a career success, and can build a legacy that's very supportive. And in a way, you are building that legacy. So, and you're in a place of figuring out what that legacy truly look like. So that's very exciting.
Yeah, it's not at all where I would have ever expected to be. In fact, I told my husband when I met him 14 years ago that I would never open my own practice because I don't want to care who turns on the lights every morning. I'm just not here for it. So the fact that I now lead a team of 10 and successfully have done it from literally nothing is not anything like I would ever have thought. I would have never expected to be here. So I'm excited to see where I am 5 years from now, because I can tell you where I think I'll be, but it's going to be completely wrong.
We're being hopeful for the future. We don't have to be right about the future. So yeah.
I would have never told you I would write a book, that I would produce a course, that I would own a business. If you had asked me 6 years ago if any of those things would happen, I would have said no. And here I am.
Yeah.
We'll see what happens.
Give everybody else the hope, right? Even you never thought about that path, go read Monica's book and figure out if that's could be a good path for you. And if it's yes, then there are plenty of options for you to grow and follow her work and follow everybody else in the industry has done it before, and figure out what's the easiest path, right? Because building a business, marketing, branding, all that, there are 10,000 ways to do it. Doesn't mean you have to do all of it. You just need to figure out what makes you feel good, what success looks like for you, and this one path that will be easier for you to duplicate. And that means that's measurable, that's productive, and then you can always course correct. So excited for that. How can people find your book or get in touch with you?
Absolutely. So my book is available on Amazon. It's DPC, Dream Job or Total Disaster. And I'm sure we can link it somewhere in somewhere. You can always find us on all of the social platforms. We're on my DPC practice, which is Impact Family Wellness. So go look at my face 42 times there. You can always send me an email at monica@dpcformula.com. I'm on LinkedIn. I'm on all the things. So send me a message. We'll chat.
Yes. All you need is reaching out, right? There's plenty of help out there.
Absolutely. There's so many ways to find people now and connect.
Awesome. For everybody else, if you have already been an entrepreneur in this journey and felt the ups and downs, we would love to hear from you. What has been one factor that kept you going versus the people who are leaders who wanted to explore if become an entrepreneur is your path? We also wanted to hear from you to see, once you read Monica's book, what path did you actually want to pick? Do you want to still going down that path, or you are wanting to support others in a different way? Here is a quick summary from today's episode with Monica about what it really takes for clinicians to be a founder and to grow without sacrificing their sanity. We explored how nervous system alignment, smart hiring, and sustainable system aren't just wellness trends, they are business survival tools. Monica shared how she went from burned out to building a thriving practice, running summits, and consulting on brands, all by rejecting the hustle trap and choosing alignment over adrenaline. Here are the 5 key learning points. Your success blueprint starts with knowing your inner driver. Monica emphasized how founders often lead with ambition, but ignore the emotional wiring. Understanding your own brain default mode gives you clarity on how you lead and why some decisions or dynamics feel hard. Number 2, here's the cost to doing it all yourself. We talked about the false badge of honor in bootstrapping everything. Monica called out the hidden burned out cycle leaders trap themselves in when they don't get the right help early on, especially with operational and mental load. Number 3, hire from your relief zone, not your ego. Founders often hire people they like or who validate them, rather than those who actually fill the skill gap. Monica shared how to align hiring decisions with business energy needs, not personality alone. Number 4, vision without nervous system alignment is just a fantasy. One of Monica's most powerful ideas was that founder cannot lead effectively from a dysregulated state. Building inner resilience isn't a luxury, it's a business multiplier. Number 5, from chaos to clarity. Systems are not your enemy. Many creative or visionary founders resist structure, but Monica reframed systems as liberating, a way to reduce decision fatigue and unlock sustainable impact. Now let me ask you, have you ever resisted structure only to realize later it was the exact thing that would have saved your time or sanity?
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.